Welcome to Paper Trail, where we make academic research accessible and engaging. Let's see what the evidence says. For decades, the narrative was inescapable. Americans were the relentless workers, logging more hours than their European counterparts, always hustling. It was a foundational truth in global economics, even codified by a Nobel laureate.
And now, that truth has been fundamentally challenged. New research suggests that by the end of the 2010s, about half of that famous hours worked gap between the US and Europe had simply vanished.
Half? That's a staggering shift. But it's not because Americans are suddenly embracing European-style six-week holidays, is it?
Not at all. The paper's most compelling finding is how this convergence occurred. It's not about full-time workers cutting back their hours. It's about a significant chunk of the U.S. population opting out of the labor force entirely.
So, the overworked American isn't entirely a myth, but it's becoming rapidly outdated. This directly contradicts decades of economic understanding, stemming back to some very influential work in the early 2000s.
Precisely. To appreciate the magnitude of this NBR paper's findings, the discussion must rewind to 2004. That's when macroeconomist Edward Prescott published his seminal paper, Why Do Americans Work So Much More Than Europeans?
And Prescott's conclusion was stark. He showed that from 1993 to 1996, someone in France worked only about 68% of the hours an American worked. His primary explanation? Differences in marginal labor income taxes. Lower taxes in the U.S. meant more incentive to work.
That became economic gospel. It shaped the understanding of the transatlantic labor divide. The assumption was that lower U.S. taxes and a less comprehensive social safety net meant this gap was a permanent structural feature.
But this new NBR paper by Sardar Barinci, Lucas Karabarbunis, and Kurt C. directly takes on Prescott's legacy. They even echo his title, asking, why do Americans no longer work so much more than non-Americans?
Their answer reveals this stunning macroeconomic shift. They find that about half of the gap in hours worked between the U.S. and other advanced economies has reversed since the 1990s. The image of the overworked American is, if not gone, significantly faded.
And the key, as was mentioned, is how this is happening. The paper rigorously distinguishes between what economists call the intensive margin and the extensive margin of labor supply. Can that distinction be explained?
Certainly. The intensive margin refers to how much a given number of people work on average. Think fewer hours per week for someone who is employed or longer vacations. The extensive margin, however, is about how many people work at all. It's the binary decision of whether to join the labor force.
So, if Americans were working less on the intensive margin, that would mean a factory where everyone clocked out at 3 p.m. instead of 5 p.m.
Exactly. But the paper shows that the U.S. decline is concentrated almost entirely on the extensive margin. It's like the factory where the people who are working are still putting in their full shifts, but 10% of the assembly line stations are now empty because those workers decided it made more economic sense to stay home.
That's a critical distinction. It means the problem isn't necessarily that employed Americans are slacking off. It's that a growing segment of the population isn't even entering the workforce. That also suggests the drivers behind this shift must be pretty powerful.
They are. This leads to the methodological rigor of the paper. Comparing aggregate labor statistics across countries is notoriously difficult. How do you account for different tax codes, household structures, and welfare systems?
That's where economic journalism often hits a wall. You see headlines comparing average hours, but they rarely control for those deep structural differences.
The authors here geek out, as you might say, on their identification strategy. They didn't just look at top-line numbers. They built a sophisticated model of labor supply, far beyond a textbook approach. This model accounts for multiple sources of individual heterogeneity, recognizing that people aren't all the same in their skills or preferences.
So it's not just a generic worker, it's a spectrum of workers with different characteristics.
Precisely. They also model multi-member households, acknowledging that labor decisions are often made jointly, not by isolated individuals. And crucially, they incorporate an elaborate system of taxes and benefits, specifically modeling the complex web of transfers available upon non-employment. They calibrated this model using detailed micro-level and aggregate datasets from various countries, which allowed them to isolate specific behavioral responses.
So they're really digging into the nuanced financial calculations individuals and households are making. A common critique of these sorts of findings often comes down to demographics. People might say, isn't this just the baby boomers retiring or more people staying in college longer? Did the authors account for that noise?
They absolutely did. They explicitly adjusted their estimates for compositional changes. They stripped out the macroeconomic noise caused by the aging of the population, increased educational attainment, changes in living arrangements, retirement norms, and even incarceration rates.
So the 50% reversal in the hours worked gap isn't just a function of an aging population. This is a true structural shift in human behavior after neutralizing those demographic factors. That makes the findings even more compelling.
It does. With demographics largely ruled out as the primary driver, the researchers then conducted what they call a horse race of competing explanations for the U.S. decline in work hours post-2000. They tested things like changes in wages, shifts in the progressivity of taxes, and changes in non-labor income.
And what came out on top in this horse race? What was the definitive winner?
The definitive winner was the rise of government benefits provided to the non-employed. And among those, the authors state, we find the most important role for health benefits and, in particular, Medicaid.
Medicaid. That's a powerful and potentially controversial finding. How big of a factor are we talking about here?
To ground this in reality, consider the sheer scale. The paper cites official data showing that the number of Americans enrolled in Medicaid surged from roughly 20 million in the early 1970s to almost 100 million in the early 2020s. That's a five-fold increase in the provision of government health coverage to low-income and non-employed individuals.
A five-fold increase is enormous. So the question becomes, why would an expansion of Medicaid lead people to work less, particularly on the extensive margin?
This is where the concept of the reservation wage becomes central. In labor economics, the reservation wage is the lowest wage rate at which a worker would be willing to accept a job. It represents the value an individual places on their time outside the labor market for leisure, home production, caregiving, or dealing with health issues. If a job offer falls below this threshold, a rational worker will reject it and stay out of the labor force.
And presumably, if the benefits of not working increase, that reservation wage also increases.
Exactly. When non-labor benefits, like unemployment insurance or, in this case, health coverage, the economic value of not working becomes much higher. For decades in the U.S., healthcare was largely tied to employment. If you didn't work, you often didn't have health insurance.
A huge incentive to stay in a job, even one you disliked.
Right. But as Medicaid expanded, particularly in the wake of the Affordable Care Act in the 2010s, millions of Americans gained access to comprehensive health coverage that was completely independent of holding a job. The authors note that in their model, the increase in benefits mainly distorts the extensive margin of labor supply as it raises the value of not working.
So for someone on the margins of the labor force, maybe someone with a chronic health condition or a secondary earner in a household, the math fundamentally changed. Why take a physically demanding, low-wage job that might offer worse insurance or none at all when you can get comprehensive coverage without working?
The wage required to lure them into the workforce became much higher. If they couldn't find a job meeting that new higher reservation wage, they rationally dropped out of the labor force. It's a powerful economic mechanism.
But this raises a natural question. European countries have long been known for their robust welfare states. If generous government benefits reduce labor supply, why didn't their work hours plummet as well? Why didn't Europe experience a similar decline on the extensive margin?
This is where the paper highlights a brilliant structural irony and a key difference in welfare design. While non-U.S. countries historically offered more generous benefits for the non-employed than the U.S., this generosity has not changed as much over time as in the United States, and public health coverage does not depend on employment status or income levels.
In Europe, healthcare is generally universal. It's not tied to your employment status or your income level.
Precisely. Whether you're a CEO or unemployed, you have access to healthcare. This means that taking a job in Europe doesn't jeopardize your medical security in the same way it can for a Medicaid recipient in the US.
Because in the U.S., Medicaid is heavily means-tested. If you get a job that pushes your income above a certain threshold, you risk losing that free healthcare. That's what's known as the benefits cliff.
Exactly. The US system's specific design, with its means-tested nature, creates an active disincentive to work on the margins that the European universal system largely avoids. The cliff effect means that for some, earning more money could actually make them worse off if they lose critical benefits.
That distinction is crucial. So while U.S. hours declined, what was happening in non-U.S. countries during this period?
Their labor supply actually rose. The authors attribute this to a mix of factors, primarily rising wages and what they term the falling disutility of work.
Falling disutility of work, another great economic concept to unpack. What does that mean in practical terms?
In economics, work is traditionally viewed as a pain cost you endure to earn income. The disutility of work represents the negative utility, the physical pain, or the psychological stress an employee experiences from their job.
So if that disutility is falling, it means jobs are becoming less unpleasant or perhaps more appealing.
Exactly. Over the last few decades, globally, economies have shifted away from grueling agricultural and heavy manufacturing jobs towards service, tech, and knowledge-based roles. Jobs have become less physically demanding, more flexible, and in some cases offer higher autonomy and meaning. As the sheer unpleasantness of working declined and wages rose, Europeans were incentivized to work more hours than they did in the 1990s.
So while the U.S. also experienced a similar shift in the nature of work, the massive gravitational pull of Medicaid expansion with its benefits cliff appears to have overpowered that trend in America post-2000.
That's the paper's core argument for the divergence. The U.S. had its own period of falling disutility of work that drove hours up from the 70s to the 90s. But the Medicaid effect was a more recent and powerful counterforce.
This is incredibly insightful, but it's important to remember what these NBER papers are and what they are not. They are analytical, not normative. The authors aren't making a moral judgment or saying Medicaid is bad policy.
Absolutely. They are not saying Americans have become lazy. Providing healthcare to 100 million low-income, disabled, and elderly Americans has massive, well-documented benefits for public health, financial stability, and human dignity. What the authors are doing is quantifying the behavioral trade-offs of social safety net designs.
Anytime a government provides a means-tested benefit, it alters the reservation wage. It creates a disincentive to work at certain income levels. This paper simply demonstrates that in the U.S., that trade-off was substantial enough to erase half of the macroeconomic gap between American and European labor markets.
The primary takeaway for anyone tracking the U.S. economy, journalists, policymakers, investors, is that the mental models of the 1990s are obsolete. The idea of the overworked American versus the leisurely European is empirically false in its original form. The U.S. labor market has transformed fundamentally in the last 25 years, quietly reshaped by the expansion of the healthcare safety net.
So, if the overworked American narrative is now outdated, what future questions does this research raise?
Several critical questions emerge. First, during the COVID-19 public health emergency, Medicaid enrollment swelled because states were temporarily barred from kicking people off the rolls. As that policy unwinds now in the mid-2020s and millions potentially lose coverage, will there be a sudden reversal? Will the extensive margin of labor supply spike as people are forced back to work to secure employer-sponsored insurance?
That would be a fascinating real-world test of the paper's mechanism.
Second, if the U.S. were to ever adopt a European-style universal healthcare system, completely decoupling health insurance from employment, would U.S. labor supply actually increase by eliminating the means-tested benefits cliff?
That's a powerful counterintuitive thought. And finally, looking even further ahead, how might artificial intelligence reshape this dynamic?
As AI reshapes the knowledge economy, how will the disutility of work change in the late 2020s and 30s?
If jobs become more stressful, more precarious, or simply more fragmented due to automation, will the disutility of work rise, driving labor supply down globally? Or will new opportunities emerge that make work more appealing? It leaves much to consider.
That wraps up this episode of Paper Trail. Join us next time as we dig into more research worth talking about. If you liked what you heard, share it with a friend.
Keep reading the fine print.